Hi, my name's Yvonne Bergmans. I'm a suicide interventionist with the Arthur Sommer Rotenberg Chair in Suicide and Depression Studies at St. Michael's Hospital. And we're going to talk a little bit about suicide, that forbidden topic. Very few of us have gone through life not hearing about suicide, whether it be through a family member or a friend or a colleague or a schoolmate. And perhaps we've even inferred it by virtue of the silence around the death of someone. About 1 million people per year throughout the world die by suicide. That's about every 40 seconds someone dies by suicide. And if we think about it, there's at least 20 people who are affected when a person dies. So as a result, suicide becomes an issue that is relevant to all of us. So what we do know is that about up to 90% of people who die by suicide have been identified with having some sort of a mental illness or mental health challenge. There are some people who only receive a diagnosis after they've died and there's been a psychological autopsy that's been given. And there are a few people who, or a smaller percentage of people, who probably don't have a mental health diagnosis. And for the most part, it's mood disorders. That's not to say that there aren't people with other mental health challenges who also have thoughts about suicide and who do die by suicide. It's important to remember, though, that not everybody who has mental health challenges will think about suicide, attempt suicide, or die by suicide. And there are many, many people who live with challenges for years and years and years, and then suddenly they find themselves at risk for wanting to end their lives. It's a really, really complex issue. It's biological, it's psychological, social, environmental, spiritual, cultural. And those are the issues that make it so incredibly complex that we can't actually predict who's going to die by suicide on an individual basis. We may know the risk factors, and we may know on an aggregate level what some of the warning signs are. We can't predict it individually, which is why it makes it such a challenging issue for so many people. We want to be able to prevent suicide, and for a lot of people we're saying, what is it we need to do in order to have that happen? Well, the American Association for Suicidology has come out with a mnemonic around some warning signs that we can pay attention to. And the mnemonic is path warm. Now, it doesn't necessarily mean that everyone who has the features of is path warm is going to think about ending their lives or try to end their lives. So first of all, the question for is there suicidal ideation? Is there substance use on board, whether that be alcohol or over-the-counter medications or prescription medications? When we get to the word path, we're asking, is there a sense of purposelessness? Why am I here? What am I doing here? My life is a waste. Why bother? Is there a great deal of anger that maybe hasn't been present before, and it suddenly emerged and the person seems angry all the time? Does the person identify feeling trapped? Trapped in their life, trapped in their head, trapped in their emotions? Does the person talk about a sense of hopelessness? What's the point? Where am I going? There's nothing out there for me. Who would care about me anyways? Do you find that the person is withdrawing from life, from family, from friends, from activities, things that they normally would have participated in, if not terribly eagerly, at least would have taken the chance to participate in, and have now decided that they don't want to be part of any of it? For other people, there's a really strong increase in anxiety. And they're very anxious. They find they can't go out. They can't do the things that they might have at one time enjoyed. And find themselves very, very nervous all of the time. And sometimes really scared within that anxiety. For others, there's a real recklessness, a who cares, taking risks that they might not otherwise have taken. And, sort of saying, well, what happens, if it hurts me, oh well. So has this recklessness either emerged or become far more exacerbated or more of it. And then we also have people who experience mood changes, suddenly become very sad. Some people may talk about just living with utter despair and utter sorrow. Other people might talk about living with a constant pain that they can't quite describe to people. And sometimes if you're the person who's seeing the person, you might notice a change in their facial expressions or in the way they hold their body, and asking them how they're feeling and whether or not their mood has changed in the last while. Regardless of the treatment that a person might be receiving, it's critical that we ask if people are having any thoughts of attempting to end their lives. How would dying be helpful for them? And how they understand how we might be helpful. Sometimes a listening ear is the best assistance that can be offered. Sometimes a referral to a specialist, and sometimes it's assistance just to get to a care provider. The point is if you don't ask, you don't know. And so reaching out is the most important thing that you can do. It might be scary to hear what the answer is. You might feel helpless. And still, it's important to ask and to help in whatever way you can. So please, remember, reach out.